We have 2,942 cases of coronavirus in the state. That's 134 more than yesterday. The Chief Health Officer or one of his deputies will be providing further information via their usual statement later in the day, but I can confirm that 11 of those 134 cases are connected to contained outbreaks, and 123 of those are under investigation by our public health team. 75 cases now in the 9 towers that are locked down. In terms of some of those being a reconciliation where they would have been known positives in our numbers but have only now been able to be attributed to residency in the towers, but the total number is 75. And the Chief Health Officer will be able to speak to that or at least provide further information at a later point. We have 860 active cases, 41 Victorians are in hospital and 7 of those are receiving intensive care. The story of the day though, from a public health and activity point of view, is the fact that we did 29,424 tests yesterday, so substantially higher than the records we had set earlier in the week. That takes us to a total of 1,008,677 tests since January 1. So as we predicted, we've broken through that 1 million test barrier, given the almost 30,000 tests that were conducted yesterday. Can I again thank every single Victorian who's come forward for a test, and the many thousands of people who are working to take those tests and to process them. It makes the point that everyone, a mighty team, a massive team of people are doing everything they possibly can. We are all working as hard as we can, doing the very best that we can. And we know that we're asking a lot of Victorians, and we know of course that we didn't want to be in the position that we are in. But that's the reality that we confront. This is the challenge that we have to meet, and I think that if we all work together over these next 6 weeks, as painful and frustrating and difficult as that will be, we will be able to get to the other side of this stay-at-home period. We'll be able to then recommence our opening up in a cautious way. We'll be able to repair the damage to the economy that this virus is doing, and along the way we'll be able to support those who need that support, whether it be businesses, families, individuals, or indeed communities. This is, as I said, not the situation that anybody wanted to be in, but it is the reality that we must confront. To do otherwise is to pretend that this isn't real, to pretend that we have other options. The best public health advice is to take these steps. That's very well considered advice. The decision to take these steps is not an easy one. It's not taken lightly, but it is the most appropriate response to, again, take control of the virus, drive down case numbers, and get to the point where we can recommence that opening up in 6 weeks' time. That's our plan, that's our hope. We'll all be working incredibly hard, day and night, to deliver that outcome. Of course, every Victorian has to join us in that effort. I'm confident they will. We have got a unique challenge in that we have significant community transmission, but at the same time we have vast areas within regional Victoria where there is no community transmission, other parts of regional Victoria where there are small numbers of cases, and we have to safeguard the status of regional Victoria. And as I said yesterday, we are doing the hard work to look at options to accelerate opening up in regional Victoria for regional Victorians. That comes with significant economic benefit for them and therefore the whole state. That is only possible if we can continue to safeguard the very low COVID or COVID-free status of large parts of regional and country Victoria. To achieve that outcome, then we do have to have a hard border between those 31 metropolitan LGAs and Mitchell Shire and regional Victoria. Again, no one is pleased to be in that predicament, to be having to confront those circumstances, but there is enormous benefit across regional Victoria if we can get that job done. Victoria Police, with support from the ADF, some 264 ADF personnel will be providing logistical support, practical support to Victoria Police. Obviously, ADF don't have the same powers as our members of Victoria Police, but they'll be working together as one team, just as they have all the way through, whether it be in the State Control Centre or working side by side with our nurses and public health officials at mass testing sites, or in the many other roles that ADF and, can I say, Commonwealth public servants who may not wear a uniform but have been very, very important to us all the way through, and certainly in recent times. I know you'll have lots of questions, so I might leave it there and ask Lisa to speak to the top line issues in relation to enforcement of these rules and that internal border issue, if you like, checkpoints, roadblocks, not every vehicle being tested, not every passenger being quizzed, but there will be a rigorous process, randomised, but constant. It'll be there throughout every day and every night to make sure that only those who have a lawful reason and absolutely need to be using that lawful reason to travel to regional Victoria are doing that. Again, I know there will be some inconvenience there. Of course there will be, just as there is with the New South Wales border closure. But these are the steps that must be taken in order to get us to a point where those numbers firstly stabilise, then we drive them down to very low and acceptable, manageable levels over this next 6-week period. I might ask Lisa to add to my comments, and then Shane will then speak for a moment, and then we'll take any questions that you have.
Thank you, Premier, and good morning, everyone. So from midnight tonight, just a reminder to Victorians that, and those particularly in Melbourne, Victoria Police will have a range of new directives that they will be enforcing. And be in no doubt, they will be enforcing those new directives that the Chief Health Officer is putting in place. They've been working mass numbers of police since bushfires commenced in Victoria. But since March, we've had Operational Sentinel, we've had the operation of our PSOs out, we've had our Operation Ribbon, which is about family violence. All of those operations will continue throughout this period. They've also, over the last period of time, been operating out in those restricted postcodes, pulling over thousands of residents, and it's good to know that in the last week and a half, most of those residents in those communities have done the right thing. And I think they've set a standard for the other Victorians, other Melburnians over the next period of time. So since Victoria Police have been doing the enforcement work, they've now done 92,215 checks. That is significant checks, and that does not include the thousands that they've pulled over during Operation Sanus in those restricted postcodes. That's just their sentinel work that they've been doing right across the state, checking people at home, following up the police assistance line, checking businesses, checking mass gatherings. And I know the Chief Commissioner will go to that. To give you a sense that obviously Victorians have now re-engaged, are starting to really re-engage again around some of the risks with COVID. Our police assistance line has gone from, during some of that May period, from about 60 to 70 calls a day to yesterday where we had 810 calls. So some of that is people reporting bad behaviour and some of that is people seeking information. So that line is available, and please use that if you are aware of people obviously breaching these restrictions. We've also had police down at the public housing towers, and they've been doing an extraordinary job down there. Hundreds of police every day, making sure that testing can happen safely, making sure food can happen safely, making sure the area is safe for residents and those who are working there as well. So I want to thank those police who are doing an extraordinary job down at the towers. Again, they've really shown what community policing can be, and it's a very difficult task. I don't think police have been involved in anything like that before. So we're about to enter the new period. Now, I remember at the time we had a lot of complaints about how many fines Victoria Police had issued. Just like then and just like now, that was absolutely critical part of making sure that Victorians complied with the directives. It was absolutely and still remains necessary in order to save lives. There is no question in my mind. So for those who want to blatantly and obviously and deliberately breach these directives of the Chief Health Officer, police will be there. Whether you're breaking your quarantine at home, whether you're having parties, whether you're having people over to your place, or whether it's about you trying to, for no good reason, go to regional Victoria, police will be there. They will have a border around Melbourne, they'll have a border, they'll have protection at different transport hubs to make sure people are genuinely moving between Melbourne and the regions. All of that is about keeping our community safe. All of that is about keeping people safe, their health safe, and saving lives. So again, can I thank Victoria Police? Can I ask Victorians, can I ask Melburnians to follow the advice of Victoria Police? They're there to give warnings, they're there to give advice, but they will issue fines where people are breaching those directives. So I'll ask the Chief Commissioner to take you through in a bit more detail how the border, particularly the border, and the other directives will be enforced.
Thank you, Minister. So from tonight, we will have an extension of Operation Sentinel, and Sentinel, as you know, is 500 police officers right across the state out there enforcing, checking, making sure that Victorians are complying with the Chief Health Officer directions. So from tonight, that will be extended. We'll have several hundred more police involved in Operation Sentinel. And importantly, with these tightened restrictions, with the border, if you like, stay in metropolitan area unless you have one of those valid reasons to leave, the huge police presence will be, it won't be an absolute ring of steel, but there's going to be a significant police presence on a whole amount of those main arterial roads you'd expect to see on the Hume Freeway, heading out to the Calder, going down to Geelong, heading to Gippsland. We're going to be there from midnight tonight. We're going to be checking people. We're going to be making sure they're adhering to those guidelines. If you don't have a reason to leave, you'll be turned back around. If someone breaches those guidelines and leaves when they shouldn't, you'll receive an infringement, $1,652. We'll have massive booze bus type operations. We'll have automatic number plate recognition. We'll have our teams out there you'd expect and you have seen in the past, the public order response teams. We'll have mounted branch. We'll have the highway patrol, and every one of the divisions right across the 31 local government areas and the Mitchell Shire. Each police superintendent has been appointed as a police commander in those areas. They have personal responsibility for making sure activities, policing activities and operations are focused on the enforcement of the CHO guidelines, as well as the state operation that we have sitting over the top of it. So significant police presence. We're going to be checking. We're going to be focused on what people should be doing and making sure they do the right thing. As the Premier has said, we've got 264 from the ADF coming to assist us. They have been assisting us already as we've been along in back-of-house scenarios, but you may see a bit more visibility of them now involved with us at checkpoints where they're providing that logistical support in the background. We'll use them at some of our police command posts for transport and a range of other roles. We're still scoping that out, but they're going to be invaluable assistance for us. But they cannot replace police in terms of the actual policing responsibilities we have and where we need those powers to do that. I think I've made it fairly clear along the way, and I've said in the past, the window of police discretion is closing. And I said it was closing and closing and closing. There's only a little crack in that window still open because we're way past a discretionary aspect. We've done this before in restrictions we've been through. People know what to do, they know what to expect, and the vast majority are doing the right thing. But moving forward through these tightened restrictions, if you don't, we will issue infringements, and it'll be a very rare occasion, an exception where discretion is used. And when I say people are doing the right thing as a majority, we've still got others who are doing stupid, selfish, reckless actions. Sunday night, we had an Airbnb party in South Bank where 15 people thought it was okay to get together and party. We issued every one of them infringements because they just can't do it. Some people are still not listening, and if the only way we can get through to them to listen and to adhere to the CHO directions is through us giving out significant fines, that's what we'll do. So we'll continue to work moving forward right across the state in a joined-up approach. That significant police presence. We'll have the ADF helping us out at the back of house and a lot of other areas, and we'll be doing everything we can to make sure that the Victorian community is safe. as a result of our enforcement. One last thing I'd like to say though, I'd like to send out a thank you to the police officers, Victoria police officers, and also to our other emergency services workers. They would never have expected to be sent to the front line to put themselves, if you like, at risk to a degree in terms of combating this pandemic. And I'm so proud of what they've done and stepped up to work with the community. So on that note, I'll close and hand back to the Premier.
Thank you, Chief Commissioner. We're happy to take any questions you have. I think that every Victorian knows and understands that this is real, it's serious, it's not over. Pretending that it is will simply make a difficult situation into a tragic set of circumstances. I think every Victorian knows that. And whilst, you know, it's always a difficult balance, Rich. You know, when you see some people that aren't doing the right thing, then you have to call that out. It's not polite in some ways. It might add to the frustration of some, but you know, we are beyond that. We need to be clear and direct and frank. And you know, I'm not pleased to be in this set of circumstances. I apologise for the inconvenience, the great challenge that many Victorian families are going to have to experience over these next 6 weeks. It's not where we want it to be, but we can't go back. We can't change those things that have got us to this point. We can only respond appropriately, and that involves everyone following the rules, because they are rules that are there for everyone. Every single family's safety is enhanced if we all do the right thing.
Where are you up to with testing in the housing condition towers, and will you be extending that lockdown beyond 5 days?
Thanks, Rachel. We are very confident that we will be able to complete testing today. There's obviously then a time is taken, even though we have dedicated laboratory capacity for these tests, because we know that this is a harder lockdown than other people in Melbourne are having to experience from midnight tonight. Our orders run for 14 days. 5 days was the time that we set ourselves. Whether we can deliver that exactly to the hour, we'll have to wait and see. But the quicker everyone gets tested, obviously the quicker we can get those results and then put in place a detailed plan to provide tailored and specific support to those people who test positive. And indeed the other challenge, which is of course we say have a family where one person or two people may be positive, but then there are other people that have got underlying health challenges or would be vulnerable for one reason or another. We're going to have to work through that and have a detailed plan for each one of those positive cases. But testing, they had a very big day yesterday. They are out there right now going door to door, and we're confident that that can be concluded today. There'll then be the laboratory time. I again say to every single resident in those towers, you will be under these restrictions for not a moment longer than you need to be for your safety, for your health and welfare, as well as for public health.
So is there a chance that some towers could be, the rules for some towers could be relaxed before others if all the testing in certain towers is being completed?
Yeah, we haven't got to that point yet. I think we need to have a complete picture across those towers, given that there are real communities of interest, there's patterns of movement, there's friendship groups, there's all of those things. I think we need to just be clear, get it all done, and that's what we're looking to have completed today. And then once we've got the results, then we'll be able to look at the actual data and then make arrangements.
What's the testing turnaround?
Oh, I haven't got the exact time, Rich, but it's certainly with dedicated lab capacity. So we have a laboratory that's only doing that work, and that's a really important part of it. If you see, I didn't think we'd get to a day of doing almost 30,000 tests. That's the product of extra lab capacity within Victoria, both public laboratories and private. And then again, we're very grateful to our interstate colleagues who have given some of their laboratory capacity, which is spare, and we're very grateful for that. We've boosted capacity everywhere. These are specific arrangements for those towers. They'll be done, the processing, as quickly as possible, and that's a recognition that they're under a different set of rules, a harder set of rules than anybody else.
Are you concerned, Premier, that given community anger at what has happened with the security guards and Black Lives Matter, is it going to be more difficult to get people to fall in behind you? Do you think your credibility in calling for it has been affected by those two issues?
Well, it's not a matter of calling for it. This is the law. These are Chief Health Officer directions, and the Chief Commissioner has just given every Victorian to whom those rules apply a very clear understanding of the approach that Victoria Police, with the support of the Australian Defence Force, will take. We can go back over Black Lives Matter, shouldn't have happened, but unless you want Victoria Police to literally lock up, try and arrest 10,000 people, that I think there's a range of practical reasons why that just would not have worked. In relation to other matters, they are the subject of a judicial inquiry with all the power and formality that comes from that. Again, I am accountable. There's never been a doubt about that. I am accountable for what happens across our state. That's what being the leader of the state is all about. At the same time, that job requires me to make not just the popular calls, but the really difficult, the hard calls, but the ones that have to be made. And that's where we're at. If you could ignore this or pass a law to deal with it, or wish the thing away, of course you would. If you had different options, and I know there are many different views about what the best public health response would be, but the only option I've got is to follow the advice of the Chief Health Officer and get this job done. And that's what I'm 100% committed to. That's what all of my team are working toward. And with the help of Victorians, I know with great frustration and no doubt about the difficulty that this will bring to families and businesses and the entire metropolitan community, we've got to get this done. And that's exactly the course that we're on.
Are you expecting to be called to appear at the hotel quarantining?
That's entirely a matter for former Justice Cope.
It'd be a bit ridiculous if you didn't though, wouldn't it?
Well, I'll leave you to speculate on those matters, Rachel. As I just said to you, I don't think I can answer the question any clearer. That is entirely a matter for former Justice Cope.
Chief Commissioner needs to call in for you to resign. Is that something you're considering?
No, I'm not considering that. What I'm not just considering but delivering is the appropriate response to this pandemic and seeing this through. That's what's most important, and that's what I'm going to get done.
What feature of like the Chief Commissioner or for the Minister, what proof are people going to need to provide to police or ADF if they're intercepted at, say, the Hume, to justify their travel, say if they're going to see their partner or care for their father or do shopping? What proof are you going to need or require or accept to justify travel in and out of the zone?
Well, we're not prescribing anything. We're not saying we're at a stage we need permits or that type of scenario. But if people do have identification, they do have some type of materials that can show that they're bona fide going to work, those sort of things obviously provide assistance. There is no minimum standard or requirement for what they do need to produce. That would obviously assist if they have documentation to that effect. But nonetheless, we'll work through it and talk with the people. And we're pretty good at working out whether they're being truthful with us or not. So we'll adopt a common sense approach and work through that.
Chief Commissioner, there's a number of people that live in smaller towns where it's split in half with falling into Wyndham, half Greater Geelong, for example, Little River. What's that going to look like in terms of policing those areas? Does it make practical sense to have checkpoints and police in those tiny towns?
Look, we're not saying we're going to be in absolutely every area. We're going to have moving checkpoints. They're going to be at different locations around the state, different towns. And so there may be periods of time we're in smaller areas, or it may be we're in the larger areas. It's going to be a rolling series of checkpoints. And the practicalities are, it'll be a little bit complex, but we're still working through that. And we've got lots of resources, and with the ADF to support as well, we're confident that we'll be able to really make sure people are adhering to the CHO guidelines.
What challenges, though, does it provide for services such as Beeline? We know a lot of people travelling Beeline from regional rural areas through to Melbourne. How will that look?
Areas such as V-Line, we're obviously working with the rail operators. We have a specific public transport division that has experience in these areas. So already we've reached out and established some of those meetings, working through how we can best police those. So it's very much rapidly unfolding, but we're very confident because we've already got those established relationships, those established practices, and people who have that expertise, if you like, in rail, in transport, that we're going to be able to do that and make sure that people are adhering to the CHO guidelines when they're travelling.
Police use discretion, like in the last wave, I guess, when it comes to things like driver's lessons and things that were issued last time?
We certainly use discretion where it's not cut and dry, and that's true. As I said, though, many of these things now, people are very practiced. They'll be understanding exactly what they should and should be doing, and it's those big ticket items. What these are aimed at, it's stopping those gatherings, stopping people going where they shouldn't be. They're significant issues for us. Where we do have any ambiguity, if there are ambiguity, and sometimes you can't be prescriptive about everything, we'll work through that. But generally speaking, the tolerance and discretion window is very much nearly closed.
Premier, the three uprights basically avoiding any contracts anyway by the state government.
Sorry, I didn't quite hear your question, Rich.
Three MSS security unified, last one, and the three security Wilson.
Yeah.
Are they still contracted by the state government
In any form across all of government? All of those who it seems likely, and again the facts of these matters are to be determined through the process I just referred to, are no longer playing a part in our hotel quarantine arrangements. The management, supervision and the chain of command, so that command and control model of that, noting of course that we have a pause, we're now seeing hotel quarantine return travellers move out of hotel quarantine and none coming in, and that period of time may need to be extended beyond the 2 weeks. I've written to the PM on that. That is all being run by Corrections Victoria, and the Corrections Commissioner is confident with the arrangements that are being put in place. We know and understand that that's critically important, and I think Corrections Victoria are the right people to do that.
How long did you ask for the extension of that?
I don't think we put a timeline on it. I think we foreshadowed, if you like, just in terms of giving the federal government some notice and therefore other states some notice that the 2 weeks may not be enough. And that's two things. It's not so much a reflection on Corrections Victoria and new hotel quarantine arrangements. It's a reflection in many respects that we have many other challenges to deal with. When you're doing that much testing, that much contact tracing, you've got that many positives, plus the work that the Chief Commissioner has gone to around borders and all those issues. Our focus needs to logically and appropriately be somewhere else, and it may be that we extend that out. I'm trying to recall the exact terms of the letter, Rich, but I don't think we put a time on it. That was more about being open and trying to be frank with the federal government that it may need to be longer. We'll firm that up soon.
The opposition has asked three ministers to be sacked. Do you have confidence in those three ministers?
Well, I do. And look, the opposition are not relevant to the work that I'm doing. I would note, though, that they were talking about bipartisanship yesterday. I don't know whether those two positions sit very well together, but that's really a matter for them. I haven't got time for silly political games. I really don't. We're focused on what has to be done. That is where our focus should be, on getting things done, not playing silly games.
We support the business.
Yes.
When can they expect details on what they'll be receiving, given many are closing their doors in a couple of hours?
We will have announcements to make very soon. It's important that we get that package of support right, and we will. There's been some discussions. I've had a conversation with the Prime Minister. I had a conversation today with the Federal Treasurer. I note he's made a number of comments that I think all Victorians would be very reassured by, that hardship and real need is going to continue to drive the federal government's policy response, just as it always has driven ours and will continue to. We'll make some announcements and we'll do that in good time.
Would you like JobKeeper extended to Victoria?
Well, I'll say to you, Nick, what I said to the Prime Minister and what I said to the Federal Treasurer today. Clearly, there's going to be greater needs in some parts of Victoria than there will be in other parts of our nation. And I'm reassured that hardship is going to continue to be the main thing that drives all the different tools that the federal government's using, just as it always has, just as it has for us also. I'll leave announcements. That's rightly the province of the federal government, but I am reassured that there will be further announcements made, and hardship will continue to be, so need will continue to be what drives them and drives us. And clearly there's going to be more need in some parts of our state than there will be in other parts of our nation.
The suggestions of a $6 billion hole in Victoria's economy have been mentioned this morning. Is that what your modelling shows, and how does Victoria recover?
Oh, look, there's no doubt that there's very significant economic damage right throughout this global pandemic. This virus is causing enormous damage to jobs, to businesses, to profits, to the state budget and indeed household budgets. There's no question about that. And that's why JobKeeper, JobSeeker, the payroll tax refunds that we provided, the business grants we've provided, and the next package of support that we will very soon announce are so important. But it's also, can I say, an important reminder for all of us that we have to get past this public health bushfire and get back into a position where we can start to open up again and start to repair the very significant economic damage that has been done. And that won't be a quick process in any part of the country. It certainly won't be a quick process here, but that's when, it's not a matter of the hard work beginning. There's a lot of hard work going on now. Everyone is doing their absolute best. They're working as hard as they possibly can. Do we all need to, as a community, as an economy, as all of us, do we have to do even better still? Then the answer is yes, because this is not over. It's not going to be over for a long time. There's no vaccine. There's no handbook. There's no getting away from the fact that it is real and that it's going to be with us for a long time.
When you talked a lot about complacency, how much do you think that's actually contributed to the spread of
Well, I made a number of comments yesterday, and I think that's an accurate description of the way some people are behaving. That's not every Victorian, and it's not to do anything else other than, call it out. And ultimately, all of us have a massive stake in getting past this, in containing this virus and driving down the number of positive cases to that manageable level. Because if we don't, we're going to finish up with many, many people in hospital. And we know that, for those who finish up in intensive care, there will always be a proportion who, for one reason or another, will not come out of hospital. They will die. And we don't want that tragedy here. We want to do everything we possibly can to avoid that. We see it in states that are around the world that are similar size to us, 5,000 deaths, 10,000 deaths, indeed some many, many more than that. We don't want that here, and that's why we have to stay the course and get this right. Is it an easy process? Are these easy decisions to make? Of course they're not. This is very, very challenging. Would we prefer not to be in this position? Definitely. But we can't change that. There's no rewind button. We just have to deal with the circumstances that we confront, and we all need to do it together, and we all need to get the job done. And that's what I'm 100% committed to, day and night.
Do you regret those comments, given that many Victorians felt yesterday that they were being blamed, even though they were doing the right thing throughout this pandemic?
No, and I'll leave it to you if you want to. If that's the position that you want to take, then that's part of your job. But part of my job is to be as frank and as clear as I possibly can, and that's exactly what I've done.
Premier, just with the back of the towers, some African Australian community leaders
Yes.
say some of their community aren't getting their medication from the towers. Are you aware of that?
I'm not aware of that. I know that they're. Well, I'll make sure that it's accurate. If it's just not a commentary on the people who have made that claim, that's fine. But I usually would like the opportunity to check something before I start running a commentary on it. I don't think that's unreasonable. Let's get to the bottom of that. If it's the case, then of course we'll try and remedy that as soon as we possibly can.
And are you prepared for the community leaders to play a greater role in helping authorities get more culturally appropriate meals to people in the towers, etc.?
I would say to you that there's been very significant community engagement, but at the same time, this is a dynamic environment. This has not been done before, but the reason we're all working as hard as we possibly can, and the reason why literally thousands of people down there are doing the very best that they can, is so that we can have those residents under those restrictions for not a moment longer than they need to be. I'm pleased to think that we really have made big progress in terms of testing, and my latest advice is that we have every chance, it's likely that we will have that finished today, and then that means we are much closer to those restrictions being lifted than we've been since they were imposed on Saturday. And again, I would just make the point again. It's not as if people decided that this would, just be a good thing to do. It was advice from the Chief Health Officer, because he had very real concerns, and he still has very real concerns, that if we didn't pull it up in those towers, if it got right away, and we had literally hundreds and hundreds of people infected, then the outcomes would be terrible, terrible outcomes. Everyone's doing their very best, and with these tests being already taken and those that will be completed today, we get the laboratory time, there is some time there, but we get the test processed, and then we can make some future, some important decisions to get those restrictions off.
In terms of education, I know it's still, much of it is still in flux and being determined, but
Yep.
are you concerned that Victorian students, with all this disruption, will end up falling behind the rest of Australia?
No, I don't think so, Nick. I think that our teachers and staff, parents, students are all committed to doing the best they can to make sure that if we do get to a flexible learning model, a learning from home model again for those other than our VCE and special needs at specialist school kids, then we will all do the best that we can. I think it was very important to be clear yesterday about Year 11 and Year 12 students. Obviously, we don't want a situation where the VCE in metropolitan Melbourne is in any way different to the VCE in regional Vic, and that's why having them on the same footing, plus of course the fact that as young adults they're in a better position to be able to distance and to follow those rules. And of course, I went to the needs of specialist school students and their families yesterday. That's been, I think, very strongly supported by those families. It really is very challenging to try and have homeschooling for those kids. We haven't made a decision yet. I can't rule out the at-home learning. That'll be based on Chief Health Officer advice and some further work that we have to do.
The Chief Health Officer made the point yesterday that a high proportion of what was yesterday 90 cases at Altufla College, and if you've got any numbers,
I don't, Rachel, sadly, on any of those outbreaks, but the Chief Health Officer will.
That's okay, but he mentioned that a high proportion of those cases were in older students.
Yes.
Does that give you cause for thought on whether we should have VCE students returning to the classroom, as inconvenient as it would be?
No, because the Chief Health Officer has turned his mind directly to that issue. And will Year 11 and 12 look a little bit different than it might otherwise have in terms of the way schools operate? Yes, I think it will be. I think there'll be even more vigilance to make sure that students are keeping their distance, that we're all being as careful as possible in those really practical things: hand hygiene, cough etiquette, social distancing, all those rules that we've become quite familiar with. But I think the judgment of the Chief Health Officer is that given the age and the likelihood of compliance with those basic rules, that is a much lower risk, and it is a manageable and an acceptable risk, and that's certainly a much better situation than having our kids that are at the most important time of their learning. Every day at school is important for every student, I know, but I think we all understand that Year 11 and 12 they are in a unique place. That's really important that we get them back on Monday.
Have you advanced any financial assistance for those businesses, particularly that are going to be hit by this second lockdown?
We'll have more to say about that quite soon.
Chief Commissioner, the Chief Commissioner.
Certainly.
You say there won't be a ring of steel as such, but what do you say to people who think they can penetrate the walls?
The chances of actually being detected are going to be very significant. We expect to see a lot less traffic out and about because of these restrictions. People can only go out when they have one of those 4 legitimate reasons, and so the probability of being intercepted, questioned, asked where you're going and why is very, very high. So when we say there's not an exact ring of steel, I've outlined already, we are going to have significant rolling checkpoints, roadblocks at a range of areas, active police patrols, local patrols, specialists. We're going to be using our number plate recognition technology. So the opportunities of being intercepted and being given infringement if you're not supposed to be out there are very, very high. I wouldn't want to be betting against it if I was out there doing the wrong thing, I can tell you.
You mentioned earlier that there was going to be an extra few hundred officers join in Operation Sentinel in terms of the lockdown. Where are those resources coming from? You're going to be pulling in officers from regional and rural parts of the state to assist, or how are we making up those extra?
We are already using officers from different areas across the state to assist in the Operation Sanus operation, which has been those restricted postcodes. We'll be able to use those as well across all of the areas in the state, but assisting Sentinel, as well as we'll be targeting, when I say targeting, selecting from other stations and like locations, as well as specialist areas, and also our back of house areas where our police officers will pull them out and get them a bit operational as well. So there'll be significant extra police resources out there, because we've got no greater responsibility at the moment than actually trying to make sure we keep people adhering to these CHO guidelines.
Do Victorians expect to see ADF officers alongside police at these checkpoints as well?
Yeah, we're still working through that, but I think realistically we'll probably see some ADF officers at some of these checkpoints, at these roadblocks, assisting with some logistics. They obviously don't have police powers, but their presence will be there. It's a reassuring presence as well, but to assist us in our setup at those roadblocks. So they'll be doing that, as well as a range of other things. So yeah, the public can probably expect to see ADF out there near police where we're doing those checks.
And you're also expecting now an increase in fines potentially with this lockdown. In your former role, you were responsible for reviewing all those fines. What's the plan now? Who does that fall to?
Yeah, when I transitioned to Chief Commissioner, I did say to Rick Nugent, as the new Deputy Commissioner for Regional Operations, guess what, Rick, you're actually got to pick this up now too. And so on a daily basis, he is actively reviewing fines as they're being given out, because that's an undertaking I gave. That's an undertaking that's transitioned to him. And that's an assessment. But as I said, we have a range of other checks and balances in place through formal review processes, but that will continue on through the current Deputy Commissioner. And yes, I do, I hope it's not the case, but I do expect to see those fines increase because people need to be aware there are consequences for non-compliance.
We'll just go back to daily reporting of fines and breaches during the 6-week lockdown.
Look, we'll explore what the reporting regime should be, what's most appropriate in terms of when the data is settled, because there are complexities in terms of reporting immediately because you don't have accurate figures. So we'll work through what's the best way to share that data with the public.
Premier, can I ask you, in golf last time you were very, very strict on why not this time?
Well, golf essentially made a decision last time that they would very early on not play. They would close courses. Then as the stage 1, stage 2, stage 3, as we rolled through all of those different restrictions, it was simply not appropriate to be winding that back. We've got a new set of rules in relation to 2 players, so groups of 2, same for fishing, same for a whole range of other activities. It's also based, Nick, on the fact that the Chief Health Officer has the certainty now of having looked at those restrictions in the first wave and knowing that it's a very low public health risk. Again, it's not something I'll be doing. I don't have time. I'm very much focused on doing other work.
For activities like that, fishing, golf, surfing, does it have to be in your LGA?
There's not a local government requirement, but it's got to be in metropolitan Melbourne. It can't be more than 2 people. You need to be 1.5 metres apart. You need to be doing the hand sanitising and all the other work. And again, it's not an invitation to spend every afternoon fishing. It's not an invitation to play 36 holes of golf every day. It's in the context of daily exercise, because we want people to be able to get fresh air and to be able to do those things that they can do safely. The other point to make, of course, is that clubhouses are closed, all of those sorts of things, so it is genuinely outdoor activity. There are many other examples as well that we think are low enough risk that risk can be managed. But if I got different advice, then the rules would change. That's the nature of these things.
A lot of the interstate newspapers, interstate politicians are, for want of a better word, mocking Victoria in many ways. How do you feel about that? Reading those interstate front pages?
I've got a pretty thick skin, Nick. I'm focused on doing the job I have to do. The issue here is I would focus much more, say, on the support I'm getting from other states rather than anything else, and whether that be testing capacity, contact tracers, all sorts of other support from the Commonwealth, support across the board. Just as when other states have their time of need in fire or flood, Victorians are the first to put their hands up, the first to go and put themselves in harm's way to support and protect others. We're very grateful to be getting support at our time, during our time of need. This will pass if all of us take it seriously. We will get to the other side of this six-week lockdown if we all take this seriously and if we all acknowledge that whilst it's not the place we wanted to be, whilst it's not the circumstances we wanted to confront, this is the reality that we face, and we've simply got no choice but to push on and to get this job done. That's what I'm focused on doing, and that's what every Victorian needs to be focused on doing. We'll have many more announcements to make about support, many more announcements to make in lots of different areas. If there's no other issues today, I will see you tomorrow.